Alrighty, so good afternoon and welcome to our afternoon breakout session. My name is Susan Hunter. I was on the organizing committee for this conference, and it is my pleasure to introduce Dr. Diana Zadorov, who is a research scientist at the Institut Universitaire sur la réadaptation en déficience physique de Montréal, and an adjunct professor at the School of Rehabilitation at the University of Montreal. Thank you very much, Diane.
Thank you. So I think because of the tech issues, I will just my camera, so it will be easier. I will share my slides. Okay, that's good. Can you hear me?
Hi there, just to confirm that we can hear you and see your slides.
Okay, thank you very much. So hello everyone. It is really a pleasure to be with you this afternoon and share the results of our study, which explored the factors affecting physical activity levels of individuals with lower limb amputation. As we all know, a lower limb amputation is a major life-changing event that can significantly affect social participation of people with limb loss, including their participation in physical activities and sports. If we look in the province of Quebec, there are approximately 1,500 persons that undergo a lower limb amputation each year. And of these amputations, 90% are mainly due to these vascular causes. And the prevalence of the number of amputations has been projected to rise, mainly because of the increasing incidence of diabetes, which will in turn increase the demand for different types of interventions, including physical activity interventions. Here, I just want to briefly define what is physical activity and exercise, just to make sure we are all on the same page about these concepts. So physical activity is a broad concept defined as any bodily movement produced by skeletal muscles that requires energy expenditure. As such, it includes sports, but also a diversity of activities of daily living, such as gardening or cleaning the house. On the other hand, exercise is a form of physical activity, but is more structured, repetitive, and aims to improve or maintain physical fitness. There is abundant scientific evidence that has documented the benefits of physical activity on health. For instance, regular physical activity has preventive effects on cardiovascular disease, type 2 diabetes, and degenerative diseases such as osteoporosis and osteoarthritis. And all of these are common comorbid or secondary health conditions associated with lower limb amputation. In addition, for individuals with lower limb amputations, besides improving physical function, participation in physical activity improves perceptions of self-esteem and body image. It is important to mention that physical activity guidelines specific for people with limb loss are not yet developed. Until this issue is resolved, the recommendations of the Canadian Physical Activity Guidelines should be followed. To achieve health benefits, these guidelines recommend that adults aged 18 to 64 years should accumulate at least 115 minutes of moderate to vigorous intensity physical activity per week. Concerning physical activity participation of people with lower limb amputation, there are only few studies that have investigated this topic. These studies report a great variation of physical activity participation. In general, their conclusions are that people with limb loss do not participate enough in physical activity to gain health benefits. For example, in one systematic review by Barragu and colleagues, it is reported that between 11 and 61% of individuals with limb loss participate in any sport or physical activity. So physical activity participation of individuals with limb loss can be influenced by different factors at the intrapersonal, interpersonal, or environmental level. For example, at the intrapersonal level, health conditions such as fatigue or pain the residual limb may impede physical activity participation. At the interpersonal level, social support from family, peers, or health professionals may enhance that participation. And at the environmental level, lack of access to adaptive sports equipment or a specialized prosthesis may be a barrier to physical activity. Given that physical activity is one modifiable risk factor that can reduce the likelihood of secondary health conditions and can improve overall quality of life, the goal of the study was to extend previous research by examining the potential factors that may affect physical activity participation amongst individuals with limb loss in the province of Quebec. So more specifically, we wanted to determine the perception of individuals with lower limb amputation about their physical activity participation, explore their perception of the different barriers and facilitators that they face, and also determine the factors that may affect their level of physical activity. So we conducted a cross-section observational study in which we randomly recruited participants from a list of 917 individuals with lower limb amputation who have received prosthetic services in 2019 from our prosthetic department, which is situated in a rehab center in Montreal. And we also used a stratified sampling to ensure the representation of women with lower limb amputation, who represent around 30% of Canada's amputee population. The inclusion criteria were to be 18 years of age or older, to be able to understand French or English, to have an unilateral or bilateral amputation from any etiology or level from at least 6 months, and to be living in the community. And we also included users and non-users of a prosthesis. So for data collection, we developed a lengthy questionnaire that had 6 sections and 113 items. We had a section on socio-demographics and prosthetic use. The section investigating barriers and facilitators was developed following a literature review on this topic among people with limb loss, but also in populations with physical disabilities. We also used the social ecological model to ensure that potential barriers and facilitators covered intrapersonal, interpersonal, environmental factors that may influence physical activity participation. Physical activity level was assessed with the physical activity scale for individuals with physical disabilities, the C.E.T. So, which is a 7-day physical activity recall questionnaire that has 13 items. And we also collected information on participants' perception of their physical and mental health using the PROMIS Global 10. Our data was collected by phone interview, and each interview lasted around 45 minutes, and the information was directly captured in a REDCap database. So one of our first steps in analyzing the data was to classify participants as either active or non-active. To do so, we used each question of the C.E.T. So first, we computed the weekly number of minutes of light, moderate, or vigorous activity. And in each question of the C.E.T., the metabolic equivalent values were provided. So just to remind you, a MET is a physiological measure expressing the energy cost of an activity. And then participants were classified as active according to the Canadian Physical Activity Guidelines if they responded to either of the following criteria: at least 75 minutes of vigorous activity, or at least 150 minutes of moderate activity, or a combination of both. To determine the factors that best predicted levels of physical activity we performed a multivariate logistic regression analysis. So a statistician built different models using the activity status of participants as the outcome and using as potential predictors gender, age, level, and etiology of amputation, the global health measures, and different barriers and facilitators. So if we look at the results now, for feasibility reasons, we aim to recruit 150 participants. To do so, we had to approach 285 individuals, and at the end, 151 accepted to participate for a response rate of 53%. As you can see, the participants had a mean age of 58 years, and we're using a prosthesis close to 22 years on average. 94% of the participants were prosthetic users. The majority had a below knee amputation secondary to non-dysvascular causes. More than 50% had a college degree or higher, and 41 were still working. Regarding participants' physical activity levels, we were very surprised that 56% were classified as being physically active. So meaning that they met the recommendations of the Canadian Physical Activity Guidelines. And when we look at the mean time performing moderate physical activity per week, it was 346 minutes. So which is more than the double recommended by the Canadian Physical Activity Guidelines. And now if we look at the PASIT scores, they're a little bit more difficult to interpret. The mean score of our sample was around 13 met-hour per day. And in the original study of Washburn and colleagues that have developed that measure, the mean score of their participants was around 20 met-hour per day. So it was higher in their study. So we can also see that physically active participants had a higher PASIT score than non-active participants, which makes sense. So here we have the results for the most important barriers among the 38 that we explored in our questionnaire. So the most important perceived barrier was an uncomfortable prosthesis, followed by the COVID-19 pandemic. And other barriers were related to the availability of adapted prosthesis for sports, the amputation itself, pain on the residual limb, and being too tired to exercise. The most important facilitators reported by participants were that physical activity improves physical health, independence, level of energy, mental health, and self-perception. And other facilitators were that people participate in physical activity because they enjoy it and are motivated to do it. So here we have the results from the multivariate logistic regression analysis, and I am presenting to you only the best fit model. The best fit model is defined as the one that explains the greatest amount of variation using the fewest possible predictors. So our results show that being physically active was significantly associated with having a higher mental health score, while being older than 65 years and perceiving as a barrier not being fit enough were associated with being less active. So just to remind you that 56% of the participants in our study reported being physically active. And this percentage is higher than the self-reported levels of physical activity in the Canadian adult population, which was close to 53% in 2009. And furthermore, the physical activity levels of our sample were higher than what was reported in the literature specific to the limb loss population, where the majority of individuals had lower levels of physical activity ranging between 32 and 43%. So some possible explanations are that our participants were younger than the amputee population of Canada, and 69% of them had a non-dysvascular amputation, while it is well documented that dysvascular reasons are the main cause of amputation in Canada. However, there were several studies that have shown that physical activity participation is higher in traumatic amputees. And in addition, it is well documented that some individuals with this vascular amputation cannot always be successfully fitted with a prosthesis. Therefore, they will probably use less prosthetic services. And this could explain the greater proportion of non-dysvascular participants in our study. The results of our study indicate that age, mental health, and perceived fitness were related to activity participation. So if we look at the first factor, age, we found discrepancy in the literature concerning the association of age and physical activity. Most studies reported that age was not associated with levels of physical activity, with the exception of 2 recent studies that showed that increased age was inversely correlated with physical activity. When we look at the modifiable factors, we found only 3 studies that have investigated the association between mental health and physical activity. And 2 out of these 3 studies found a positive association between better mental health scores and level of physical activity. In regards to perceived fitness, this concept is closely related to physical health perception. There are several studies that have reported physical health to be an important barrier to physical activity in persons with limb loss, but also in persons with physical disabilities. So if we look at some implications for practice, the findings from our study really reinforce the relevance of developing interventions that target factors shown to be affecting physical activity participation, and not only perceived barriers to physical activity that are not always associated to physical activity levels. And we also know that access to mental and physical care is not always easy for individuals with limb loss. However, increasing access to these types of interventions, specifically for older adults with lower limb amputation that live in the community, may enhance their participation in physical activity. So to conclude, future research should focus more on assessing physical activity in larger samples and using objective measures such as activity monitors rather than self-report measures, just to have a more accurate picture of physical activity participation. And there is also a need on investigating factors affecting physical activity specifically for non-prosthetic users. Because in our study and in other studies, these individuals are underrepresented, and their participation in physical activity is paramount to improve their health. So thank you very much for your attention, and I'm ready to take your questions.
Thank you very much, Diana. If anyone has questions, can you please put them in the Q&A box? I also want to let you know that the next talk will be starting at 2:35, and there's to be a 5-minute break, so we have time for probably 1 or 2 questions before we need to go to break. Do I have a lot of thank yous for your presentation? Yeah, it was definitely very interesting, and I must admit I'm quite surprised at the level of activity that was reported from your sample as well. Yeah, can you talk a little bit more about the why this group would be so high functioning in terms of time?
Yeah, we spend a lot of time thinking about that, and I think it's mainly because maybe, like I said, these vascular amputees are don't consult as many for prosthetic services.
Right.
And we recruited from our prosthetic lab. And
Okay.
even if we had a list of 917 and we randomly selected them, honestly, we're very surprised that that we don't have a representation of these vascular amputees.
Great. So I have one last question before we go to the break, and it's from your expertise, is there any available research addressing barriers to accessing physical activity for older amputees?
In most of the studies, yeah, the samples were pretty young. Majority of traumatic amputees. So there's lacking data on specifically on these vascular persons, non-users, as I said, non-users of prosthesis. So there's a lot of research to be done in these areas.
Right. Gonna have to leave it at that because of our next session. So again,
thank you.
Join me in thanking Dr. Zidorov for her presentation. And again, thank you very much.